Migraines are horrible. They're not just a really bad headache. They are a totally different physiology happening in your body. If you are one of the poor people who suffer with migraines, I am so sorry. They're one of the most devastating and debilitating suffering. So, what are the causes of migraines, or how do we treat them? There are lots of medications out there that are rescue, that you're already starting to notice the pain, you treat, or potentially you can take them or use it regularly and try to prevent them. But are they actually treating the underlying cause? Do we have a tryptophan deficiency? No. However, they're very helpful. If you want to look at the underlying causes, these are some of the key things that I see in my patients that are suffering with migraines, that treating actually does reduce the frequency and the severity. So the first and most basic thing that I see most commonly, honestly, it's hormones for females. Actually, men, it could be too, but it's not just that you have an overt imbalance. It could be that, but it also could be just the change. So when we have a drastic change or shift in our hormones, which actually we should have if we have a healthy cycle, but if it's too significant, or if we don't have the ability to handle the natural shift of our cycle, that can trigger the migraine. So it can be a migraine at or around your period starting, or at ovulation. Those are the most common times that I see menstrual or cyclic migraines happening. And sometimes it's a cause of too high or low of a hormone, or a really rapid fall from high to low, or a spike. But sometimes it's just that your body is doing what it should do with your hormones, but your baseline threshold of the migraine threshold is too low. So that normal shifting pattern of hormones is allowed to trigger this migraine. So other things that can trigger or change that migraine threshold, mold and mycotoxins are absolutely notorious for contributing to migraines. What do I mean by mycotoxins? So what's released into the air from a toxic mold is a mycotoxins. You breathe it in, it can affect your brain, hence migraines. It can cause fatigue, brain fog, allergy symptoms, all sorts of other problems. You can test your home or environment. You can test your workplace. A lot of old buildings, so old courthouses or government buildings or schools, can just have mold even in their vents that you can't see it. So just the fact that you don't see any visible mold doesn't mean that it's not present as a mycotoxin in the air of that building. So testing the home can be very helpful, and then there's lots of other things you can do to support your body, detox, bind the excess of mycotoxins, things like that. Histamine and mast cell activation